We're going to head straight into our Zoom room now where we have got the Department of Revenue and Taxation Director, Dafne Shimizu. Good
Sad.
morning.
Sad.
Good morning,
Are you
Daphne.
sad this morning, Duff, or are you happy?
You know what? Every day I'm grateful to get up in the morning and be able to do what I do. So I'm happy. It's Monday.
There you
Happy
go.
Monday, Chris. Happy Monday, Bree. Happy Monday, Jason. And happy Monday, Guam.
Well,
I know there's a lot of
Yeah.
Things going on.
I
I think people have a lot of questions
We
about
do.
the rise,
Yeah.
what's going on. And I know, of course, but maybe you guys can start with what questions you have and I can see if I can answer them. I'm going to do my best, the best that I can.
Well,
Go ahead, Bree. Ladies first.
so which one are we following? The executive order or the public law?
Sure. And so, of course, Governor did, or the Chief of Staff, John Calvo did issue a memo on Thursday regarding the executive order, and of course, advising that after meetings with certain government officials in Washington, D.C., the governor and certain members of the fiscal team were able to get confirmation that the use of funding for a program like the RISE would be okay. I mean, it would be acceptable at this time. And so that's, I think, first and foremost, probably one of the greatest pieces of news, because I think, number one, the funding issue was a concern. I know there have been a couple of bills that were introduced. I hear that they have been, that they did pass into law. And of course, those are things that we're going to have to look at to make sure that we can, understand how perhaps those may, if they are going to be implemented that way, they would. But, the governor, when I did have the opportunity to speak with her last week, of course, the main thing, and I think you saw it even when Lieutenant Governor Tenorio was acting governor, the main thing that has been a big issue was, the requirement of documents and making the process cumbersome for our people. And that's been huge. Of course, 2 weeks ago, acting Governor Tenorio did issue a letter advising that, we would try to address the issue of mayor's verifications, because our mayors have been, seeing a huge demand in those verification requests. And it's been challenging for them to address that issue. And then, of course, again, last week, that you could see it through the Chief of Staff's letter that, Governor does intend to issue another executive order. Bree, I don't have the information on the executive order, but again, if you read through, the main issue is, again, it's just the challenges, one, that we've had in trying to implement, and two, just trying to make sure that the process is as least cumbersome or as easy as possible, but that we still meet what we need to in order to make sure that we get our people their money. And again, that's been really, as I understand it, that's been the main issue. And, I think, I remember back in 2019 when I first sat with Governor on a really serious matter, and she just basically, her advice was, Daphne, you just need to do what's best for our people. And then again, last week I spoke with her, and, she reiterated that same message, is that we're just, of course, trying to help our people the best we can, given some of the challenges that we are having. And I spoke with you a few weeks ago about, us trying to address the issue of eligibility and some of the language in the law that we were having a challenge with. In particular, I think it had to do with dependent eligibility. Those are things that we've been trying to overcome. But outside of that, I think just the process, it being very cumbersome, has been a very huge issue for Governor and Lieutenant Governor, and of course us as well. I think that, for us as well, it's challenging because, for other programs, we didn't require as many documents. And so, it's the question of, why are you now requiring all of these documents? Especially if we, for certain cases, we may have the wherewithal or the information that we need in order to be able to process these payments. And again, those are the things that, of course, we want to make sure we address. And I am not sure, at this point, because the bills have passed, I think that likely legal will have to review. And so that way, if there is some type of response, that will have to come from legal, and we'll have to go ahead and communicate with them on that, about how now this or these new laws will impact what currently exists.
Right, and I think, one of the things on session floor, senators kind of basically said, do these bills really even matter. The governor will more than likely veto these bills, and it's mainly just a message to her, like, just pay it out. And they're removing the $30 million cap. I know that when we got a message from Crystal when we asked her, so is the governor going to keep to the $30 million cap even despite this executive order whenever it comes out? And she said yes. So I'm not sure how this is going to work out. Are we going off the executive order? Are we going through this public
Right.
law? The Mayor's Council of Guam, from the meeting that they had with DRT, they're basically just recommending go get the mayor's verification, because there's going to be 3 piles. There's going to be a completed application with the mayor's verification. There's going to be a second pile with a completed application without a mayor's verification. We're going to get that later. And then there's going to be a third pile, and that third pile is going to be incomplete applications. And so because this is now a first in, first out type of situation, if you want to get it quicker, you better get that mayor's verification. But now we're in limbo because we don't know what this executive order is going to be that's coming out from Adelup on the streamlining of the application process. And so on top of that, are the All Rise applications, are they really going to be ready by September 1st?
Well, you know what, I think that, again, if you look at the rules and regs, well, at least if you look at, I believe Speaker Trelahaye's bill, it did strike out the rules and regs section. I believe that the issue of mayor's, or the required documents were actually, found within that area. And so, my understanding, again, based on, and I have to go back and review Speaker Trelahaye's now law, bill, because it has to still go through the governor. But I still have to review that so that we can make sure we understand it. But my understanding is that at least if you look at it, the area of the rules and regs was struck out so that the director can have the ability to go ahead and provide the rules and regs for that without, again, being restricted to what was already there. So, I know that the intention is to give us some level of flexibility. But again, of course, we'll have to wait to see with regards to the executive order, what language will be issued, or what the issue will be, what will be issued with regards to the executive order. I do have to say, though, with regards to the issue of funding, I think that, one of the big challenges we saw with regards to the RISE Act was, and again, I am not the expert on the funding language piece, but I believe that how the RISE Act reads, the original RISE Act, is that it seeks to utilize FY 2021 funds there are 2 potential funding mechanisms: FY 2021 funds or the ARP Act, or some type of federal funding that we get for to address the issue of this public health emergency. It's the governor, and I think it's been clear that the governor has full authority over the federal funding in terms of it's really at the governor's discretion, and that's something, of course, that she's been working with Director Byrne and Director Carlson on, with regards to, again, the potential use of those ARP Act monies. And again, so the funding issue is a huge issue. I don't know if with regards to the law that and I apologize for not having read through that whole thing and being prepared completely for it, but with regards to with regards to the bills that passed last week, I'm not sure if it addresses the issue of the source of funds. And so that may be, again, an issue that comes up, because the governor does have full authority over the federal funding that comes through.
Right. This is kind of the same situation when Senator Amanda Shelton introduced her Zuderman GAFA bill, where she prioritized the use of federal funding, although everybody knew that the governor can do whatever she wants with the CARES Act funding back then. But the bill still went through. The governor allowed it to lapse into law. The Zuderman GAFA was paid out. And now this is kind of the same thing. And I think that's why senators on session floor were like, what are we doing? We don't really need to do this. The governor can pay this out. And she's kind of already made that clear that she was going to use, or is going to use, the ARPA money, because why would she go ask Treasury, like, hey, can I use this for RISE Act payments or All Rise or whatever it is now?
Well, just to share with you though, like when we did meet in the last week with, of course, with Governor coming back, the discussion with the Treasury and the review of the interim guidelines is actually quite important. There, and I know legal did bring up certain questions with regards to the use of funding because, and again, I'm not as familiar with the interim guidelines or the final guidelines. As I understand it, the final guidelines have not yet been issued, but the interim final guidelines do have specific language with regards to the use of the funds for certain programs. And as I understand it, that was one of the questions that there was there was clarification with regards to, and again, that's use of the funding for a program because I think there's a concern that the funding should be utilized for only those individuals again that have been somehow severely impacted by this particular I guess by this public health emergency, right? And if you look at the guidelines, my understanding is there's language that specifies that people must have been harmed. And so again, I think, and if you saw though, like when we did deal with EIP1, EIP2, or EIP3, there hasn't been a requirement that people prove that. And it is difficult to prove too, Bree. I mean, I think that, even as I was thinking about it, if in fact, we were going to require people to prove that they've been harmed. I mean, it's just honestly, that is a very difficult process to prove. And that's why, again, I think we saw with EIP 1, 2, and 3, we looked at a specific group of people who had or fell within certain income thresholds and utilized the funding was used to address, of course, them because, the idea is that those people are the ones that are most severely impacted. Again, those below a certain income threshold. And I think that, again, that was one of the issues was, although EIP 1, 2, and 3 have passed or were authorized in that way, because there was some language in the interim guidelines that indicated, I guess, this issue of people being harmed. I think that was one of the questions. Again, that was one of the questions that was brought up when we met this last week. And again, of course, that was something that I believe we've been able to work through. And so, of course, now Governor feels comfortable that we can move forward with trying to fund this using ARP Act monies. But, I totally understand, the issue. And we do understand that concern, of course, that people are wanting this money. And we're, again, doing our best to try to just to navigate through it all. I have to tell you, this hasn't been an easy process for me and my team personally as well, or me personally and our team here, because there have been language issues that we've had to try to overcome and try to figure out how we're going to address. And, we don't, again, our intention is to try to make payments out. I know with regards to the bills that have passed last week, we're going to have discussion about those, how they may or may not impact things. And, again, I have not seen yet any of the draft language or language for the executive order. But again, we're hopeful that, of course, legal will review and work to address those, again, in conjunction with the bills that passed last week.
So let me get this straight. Are you guys now saying that the RISE law was very flawed and that it was impossible to implement it?
I think that I don't know that, of course, anytime we do things, right, we have to make sure we follow the law. What's different, and I think I've mentioned this before, with regards to RISE, is we kind of compare it maybe with Program and Salapi or even the GITA grants that we've seen, is that those were not authorized by law. When there is a program that's authorized by law, we really have to follow like the letter of the law to make sure that we're following the law. Now, in terms of the language, there was language in the RISE Act, even between the rules and regs and the law itself, that did conflict, or that did where we did have challenges with. If you look at the rules and regs for the original RISE Act, there is discussion about an individual who has. Well, first of all, it states that you must be a Guam taxpayer in order to be eligible. But then in the rules and regs, it goes on to state that if you are a Guam to define Guam taxpayer, and I think, Bree, you could find that in section 1A3, is probably the area of the rules and regs that we had the most problem with, which refers to individuals who did not file returns because they did not meet the threshold. And that was probably the hardest language. So to go back to your question, Chris, is it impossible? Perhaps not, but is it going to be implemented in the way that, that was contemplated by the legislature? I think that was the concern, because that particular language basically opens up the RISE Act to be able to be payable to anybody, and that anybody, including dependents, and that was one of the issues or concerns that we had. And again, we don't believe that was the intention, but that's something that we had a challenge with.
Daph, we had a comment here. What's up with the child tax credit?
Okay, so you know what? I'm happy that you're bringing up the advanced child tax credit. We've been communicating with the IRS with regards to this. As you know, in the continental United States, the IRS has begun to issue those child tax credit payments. We have been in communication with the IRS. We are hopefully in the final stretch to get our advanced child tax credit plan to be approved by the Treasury. That's something I hope to happen very soon. And so, of course, the law requires that payments be made to eligible recipients in monthly installments, through the year. And so, again, in the continental United States, we're seeing payments begin in July and go through December. For Guam residents, of course, we're going to try to get those monthly payments out as quickly as possible. But first, we need to get our implementation plan approved, and we're hopeful that that's going to happen really, really soon. I was communicating with my IRS counterpart about it over the weekend, and we've actually honestly been going through a lot of different versions of the plan. For some reason, there's been a lot. Well, I believe, as I understand it, this has probably been one of the more complicated implementation plans that even the IRS has had to work on. And I deal with the general counsel there, who has been there for a long time. So it's taken some time to get it done, but we're hopeful that those child tax credit payments, in particular, the advanced child tax credit payments, can begin to happen. I mean, as you know, there is the anticipation of the PUA payments that are going to be ceasing very soon. And so, if we can work to get those advanced child tax credit payments out to our people, just shortly after or around the time that happens, I think that will be a great relief for a lot of our people. So we're working on that now, and I'm hopeful we're going to have an update on that very soon.
What about the vaccination mandate? Have you received any instruction on, because I think it said effective August 9th. So how does that work logistically? Do you get all the employees together and say, okay, who didn't get their vaccine? Or just walk us through your process, Steph.
Sure. So of course we did get that letter from Governor with regards to the requirement of vaccination. Our team actually has to gather the information on, who at this point is still not vaccinated. We've been working to try to get updates on that already as we've been going along. So our ASO is likely going to be working to get that list together. And then we go from there. I know there's many reasons why people have not gotten vaccinated, and so, but I believe the majority of our agency employees have been. We're just the first step is to identify those individuals who have not been vaccinated, and that's something that we're going to be doing. We were supposed to do it since last Friday, but we were not able to get those final figures. We'll be getting those today, and then providing that count so that we can again identify them, and we'll go from there.
What type of disciplinary action do you anticipate would be levied on those who don't get the vaccine or don't do the weekly COVID test?
And that's something that I guess we'll have to discuss with DOA, HR. We do take the cue from them, or the direction from them, in terms of, the rules and regs. So, if there are policies, or if there is going to be some type of a policy with regards to any action that is or will be taken, that likely will have to take the direction from the Department of Administration with regards to that and what the policy will be.
Daph, if let's say for whatever reason they're not getting the vaccine, are they going to be provided with leave time to go get the COVID test? And will the COVID test be something that's covered by the government, or will the individual employee have to foot the bill for that?
On the COVID testing, sorry, there's two areas where to be addressed. With regards to getting the actual vaccination, we have provided people with administrative leave so that way, I believe 3 hours, so that way they can go ahead and get those get vaccinated, right? So if there is someone that still is in need of vaccination, that is something that that can be done again with admin leave. With regards to the COVID testing, as you know, and of course we are kind of in a different position we were last year, but in the last year, we even had to provide a specific time frame where we had a Saturday where our agency personnel were in a drive-through line working to get, tested because we had been exposed. I'm sorry, I'm not familiar with what would the process be for the COVID testing. I'm confident that if there was some type of exposure within our agency, that we would have to definitely make sure that we address similar to how we did before, where if there is a need to isolate a certain division or branch, that we do, and that of course we make sure that we go through the process of addressing with public health so that we can get contact tracing done and get people tested as needed. So I'm not sure, again, with regards to this new guidance, how we're contemplating addressing that. But again, those are things that will wait on guidelines from the Department of Administration, likely for.
So there's no guidelines on this thing.
I'm sorry if I currently don't have the guidelines, and I will have to confirm with our team, but I don't currently have them.
Have you received any initial concerns from any of your employees? And then also, Daph, just ballpark, if you could also maybe just answer this. What's your idea, your guesstimate of how many employees aren't vaccinated? Do you know offhand?
I can pull up our last vaccination. With regards to, hold on just a second. With regards to vaccination, though, I do know some people who have had concerns. Well, on a personal note, I do know of people who have had concerns about vaccination because of their health issues. I know, I have a family member who has had severe reactions to other types of vaccinations, and because of that, has chosen to not get vaccinated. I'm confident that these are going to be items which will have to be addressed. But with regards to the vaccination update, I can pull it up from my, we actually are in need of doing a vaccination update, but let me pull up the last time that we did do an update. Sorry, I have probably one of the slower computers.
Ours will give you a run for the money.
No, so when we did change our computers, I wanted to make sure our team got their computers. So
that's the best boss ever.
It's been a long time. I don't know if you remember Windows Vista, but Windows Vista, when we actually still had people who had Windows Vista, and that was, I think, from 2007 or something like that. So we did have some really, really old systems here. I'm sorry, I don't have an update. I don't want to provide you with the number and then it be totally off, but our ASO will be working to get that update today so that we can get that information. But,
what do you think?
I think that we've always done our best to make sure that our team has access to vaccines. Yeah. Last year in December, of course, when the vaccines were just being made available, I did make sure that, we communicated to at that time, the deputy chief of staff, and of course, chief of staff and the front office, that we believe that our team should be considered, even if not first tier frontliners, but second tier frontliners, because we're always, out and exposed to the public. Yeah. So, we've done our best to try to make sure that people are vaccinated again, and that we give them the opportunity. But I don't have a final count on that.
Okay, Daph. I guess just one last question on this. Will those employees, it's a Facebook comment, will those employees with doctors' excuses to not be vaccinated because of health issues, will they still be required to take weekly tests?
And again, that those are things that I'm not certain of, but I think that in the interest of, if people are not able to, I think just kind of on a personal note, my personal perspective is in the interest of just making sure that we continue to keep people safe, that's likely prudent. But again, those are things that we'll work through. I have not gotten any, at this point, I haven't received any direct, I guess, or anybody, any concerns from the team with regards to, having to be vaccinated or this, I guess, this particular requirement. But again, those are things that we're going to have to discuss with our team so that we make sure that we address. And if there are any concerns, again, Chris, because for example, there may be people who are not able to get vaccinated or have concern because they have significant health issues, then, we'll have to make sure that we address those. I mean, we always do our best to be fair and make sure that we take care of our team. And, again, that's what we're going to continue to do even with regards to this area.
Thank you, Daph. You good, Bree?
Yes, thank you,
Appreciate
Daph.
you starting the
luck
morning with us.
This morning.
Good luck this week.
All
Yeah.
right. No, thanks so much, you guys. Have a great day. Have a great day, Guam.
Okay,
Take
we'll
care.
see you. Some comments here. Chamarita Regis. Governor is waiting for a HIPAA lawsuit. Yeah, we did have a bunch of comments here. We're just going to kind of go through some of these real quick. Regarding the RISE Act, we did have some comments here.